Hi, welcome to your practice inspiration video. My name is Dr. Tran, and I'm a board certified orthodontist practicing in Northern Virginia.
My name is Dr. Sbeih. I'm a general dentist practicing in Northern Virginia.
Tonight, we wanted to showcase some of the things that we're using in our practice to elevate the patient care and provide a better journey experience so that they can share their story with other people in the community. Now, full disclosure, Dr. Sbeih and myself, we are both users of Synapse Dental and Lightforce, two of the things that we'll be mentioning along the journey here today. We all know in today's world that everything is in social media. Everything is posted, everything is blogged, everything is recorded. And what people are paying attention to now is the story people tell. And that story is oftentimes based on their personal experience. We sometimes think that we're giving a patient a certain experience, but they might feel that altogether simply because we missed a few of the things that they're focused on.
All of us dentists share something in common in that when the patients come in, usually they're anxious, they're a little bit nervous, and they're expecting some kind of discomfort. So the goal is to make things more comfortable for them, make it a better experience from the second they walk through the door by having, the office smell nice, having a good front desk experience, to the experience that they have in the chair. So those are some of the things we are going to talk about today. And that's from things like cleanings to much bigger cases like doing a full arch.
Now, oftentimes in the orthodontic fields, we think sometimes patients are concerned just about how things are going to look or how things are going to cost. But if we carefully ask the right questions, we're going to find out what the real patient.
So do you have any questions?
The braces hurt.
Interesting. Is that the only question you have of me? And that's your concern, huh?
Oh,
Yeah. Very good. Very good. Excellent. Mom, did you realize that that's his concern?
yeah. He says it all the time, and that is one of our top questions.
And that's definitely also one of the top questions we get as general dentists, even sometimes when we're about to do a filling and it's a patient you've been seeing for, 5 years and you've done this a billion times before and they ask you, is this going to hurt? And the answer is always, there's going to be just like last time, it's not going to hurt. We're going to try to make you as comfortable as possible.
So when we opened our practice, we actually went to every place that made us have a good experience. And where are most of those? Spas, nice hotels. So we already started with the experience walking into the practice. But over the years, we've learned that in the dental chair and after they leave, it's just as important. And why is that? Because nowadays, patients write reviews, patients tell their friends about the experience. It's all how they feel after they leave that's just as important as what they feel like before they come into the practice.
And if you're a specialist like Dr. Tran, what happens is they also go back to the general dentist and tell us, hey, I had a good experience at that office. And it makes us want to refer more to the specialist or say, oh, let me refer to another colleague in the area because a lot of patients don't have a good experience at that practice. So it really matters what kind of experience the patients have and what kind of reviews they leave and what kind of impressions they get.
Now, our practice, because we have multiple specialists working in the same place, from periodontics, endodontics, cosmetic dentistry, orthodontics, pediatrics. And so the use of technology has greatly enhanced what we can give. And I'll be honest, sometimes you want to make sure technologies are right fit for your practice. But if you kind of at least go with the mindset that, hey, how can this make the patient care even better? You're going to give more things a try. And when you give it a try, you're going to show to patients that over time, you do really care about their experience.
When we have new technologies come up, we always try to demo them and decide, is this going to be the right fit for our practice? How is this going to help our patients have a better experience? So one of the things that we care about most is everything being patient-centric.
Okay. And also, we try to show empathy because we try to tell the patient that, hey, we've been through some of these things. We tried on ourselves. We tried on our staff. We don't just throw something at you that's never been done before. And when you do that before you do on a patient, it makes them feel that you are on their side. When you do it after the fact, when they've already had pain, they come back to you and then you say, oh, okay, let me give this to you now or try this now. They'll kind of wonder why you didn't have that from the beginning. So I think the mindset is if you can always implement things in your practice that can help them, it's going to take care of both the patient experience and also how they view your empathy towards their experience. And lastly, patients, we all know, come to practice with a preconceived idea of how it's going to hurt or how is it not going to hurt. And one of the things that we've experienced in our practice recently is we've been able to relieve a lot of patient of pain and discomfort that before we weren't able to.
So on the general dentistry side, patients sometimes have discomfort and sensitivity even when we're getting a cleaning. If they have recession, we tend to use topical gel or other things to make the experience more comfortable. One thing that we started using last year that has made a significant difference in the patient experience has been Synapse, the dental pain eraser. And that is something Dr. Tran introduced to me because it started off in the orthodontic field, and it has been amazing for all our patients in the general dentistry side as well. So that's one tool that we use. Another tool that we actually started using as well on the GP side is AI helping us with diagnosis. It's a great tool to use, and I think the best thing about it is when you tell the patients we're using an AI and you pull it up on the screen, and you show them how the AI detects cavities, they always are wowed by it, and it makes it easier for them to proceed with the treatment and make that decision.
Okay, so I just want to show a quick overview of how the technology works. That it's something, like I said, that you can use as a tool in your practice. Essentially, this electronic dental anesthesia sends I tell patients, kind of like a Wi-Fi signal to your tooth or your gums. And what it does is this neuromodulator will disrupt the signal so that it never gets sent to your brain. And patients go, how does that even work? Well, it just changes the sodium potassium channel system so that the signal can't go for up to 48 hours. And it only takes about 30 to 40 seconds to apply per tooth. And so quickly you can get someone from an 8 or a 9 down to like a 1 or 2. And we've used this in a lot of different arenas. And I think because I use it on myself is when I really realized that, hey, this really is something that is a tool we need to have for the patient dental experience. And so we're going to show a case that kind of brings together different disciplines in our practice and how we've utilized different technologies along the way. One of the things that I'm a big proponent of is using AI software along with customization. Nowadays, we're able to use custom 3D printed brackets. One of the companies I work with is called Lightforce, and they're able to help me digitize a plan that's made for the patient, which now allows the treatment to be reduced in terms of treatment time, reduced number of visits because now patients don't have to come as often, and reduce the force levels on the teeth. So now I'm getting patient experience for the braces part more comfortable. And now when we apply some of the other technology we use, both for lingual braces, for other retainer cases, we're able to make the patient from A to B be significantly different than what it was before. So this patient came to our practice about a year and a half ago, unhappy with her smile. She's grown up with tetracycline staining, missing some teeth. Her teeth aren't aligned. Her bite's off. She's had some previous dental work. And now she wants us to give her the smile she's been dreaming of. And with the new bracket system I've been able to use, we were able to get her from here to here in about 12 months, which is significantly about I would say at least 4 to 6 months shorter than it would have been with traditional braces.
So after Dr. Tran was done with leveling and aligning her teeth, it was our turn. So we had our periodontist place a couple of implants on the lower arch. And then we also had our periodontist do some cosmetic crown lengthening. So basically we can make her gums aligned and I could do my cosmetic work. This is a photo of the preps we did and the temporaries. I will say that for the preps, it's always interesting. We always tell our patients, when you do a case like this, you're going to have some post-op discomfort, but in 2 or 3 weeks, push through it, you'll have that beautiful smile. And we tell them to take ibuprofen and things like that. But with the new technology we're using, the dental pain eraser, I decided to try it on this patient. And since using it on her, I've also used it on 4 other big cases. And I can tell you the results are amazing. She actually went home that day, did not have any post-op discomfort 2 days after. And then she came back in when she started feeling it. We used it on her again, and we even gave her one to take home. And when she came back, she's like, this was great. I didn't feel much at all. And then we took her to her finals. And as you can see, they turned out beautiful. And she was very happy. This is her before and after. And one thing she did tell us was, how come we didn't use this technology on her before? And I told her, well, this is something new that came out. So that's why I'm trying to tell everybody, when new technologies come out, you have to evaluate it and see if it's right for your practice.
And both her children are now doing braces with me as well. So I hope that you have been inspired. I hope that you've enjoyed our practice inspiration video. And I hope that this opens your mind to being aware of all the new technologies that exist and how, by thinking of how it benefits the patients, you're going to be able to find ways to implement in your practice.
Thank you.